anything technical in German, what we like to do is we like to take the definition of the word and then we like to cram it all together.
Okay.
And it just becomes one word.
Okay.
So in German, the word for backflow prevention is Rückflussverhinderer, which means literally backward flowing water stopping thing.
This episode of Between the Lines with FGI is brought to you by the American Society for Healthcare Engineering, optimizing healthcare facilities.
Welcome to Between the Lines with FGI, a podcast brought to you by the Facility Guidelines Institute. In this podcast series, we invite you to listen in on casual conversations related to health and residential care, design, and construction. Coming to you live from Washington State is FGI's very own me, John Williams, Vice President of Content and Outreach and Chair of the 2026 Health Guidelines Revision Committee. And normally joining us from St. Louis is Bridget McDougall, Associate Editor with FGI. However, she is taking a needed break from the microphone this month. So you're stuck with me today. But never fear, we have a wonderful guest lined up, and we will get curious about how we design health and residential care spaces. First, though, maybe a trivia question, perhaps. Who knows where the word plumbing comes from? Of course, you probably do. You're all brilliant people. I did not know this, however. The word plumbing comes from the Latin word plumbum, which is the word they used for lead. Romans made a lot of advancements with plumbing, and one of the materials they used a lot was, unfortunately, lead. Lead, of course, doesn't do great things for the anatomy and physiology of the human body, but it's easy to work, and the Romans used it a lot. Also, plumbum is where we get the chemical symbol for lead, Pb. And as you have probably guessed, we're talking about plumbing today with our good friend Christoph Lohr. Christoph is a plumbing engineer, a columnist, a podcaster, and VP of Technical Services at IAPMO, which is an acronym that we're going to decode in just a minute. So let's get ready to read between the lines about the fascinating world of healthcare plumbing.
Good morning, Christoph, and welcome to Between the Lines with FGI. Thank you so much for being here. One of the first things that we should mention is not only are you the Vice President of Technical Services and Research at IAPMO, which I think stands for International Association of Plumbing and Mechanical Officials. Is that right?
That is correct.
Excellent. IAPMO is a global leader in uniform plumbing codes and standards, and these are the fine folks that publish the Uniform Plumbing Code, among many, many other efforts. All that to say, not only are you the VP with IAPMO, you're also FGI's Plumbing Task Group Chair for this cycle. Thanks for being here.
It's my pleasure.
So first off, you have a wealth of knowledge and understanding, and you've got some very specialized knowledge related to plumbing and healthcare design. So one of the questions we always like to ask folks is, how did you get here? What brings you to healthcare design and plumbing?
I really appreciate first, John, the opportunity to be here. And it's been great interfacing with FGI this entire last code cycle. And, the journey to where I'm at today is certainly one that was not a straight one necessarily. So, but I would say where I end up where I'm at is in part because I combined two of my family's sort of histories together in one. So my grandfather was an engineer, and the idea of kind of following in his footsteps was always one that was a big one for me. But my mom was a nurse, and she worked in long-term care. She worked in ERs. She worked on ICU floors, and throughout my schooling, and she was working in these different places. Often I would get my volunteer hours by volunteering at the different places she was working at. So I got to see a lot of healthcare facilities at a very young age. So after I graduated from college with my engineering degree and started working in engineering consulting, doing both HVAC and plumbing, eventually what that led me to was focusing on plumbing systems in healthcare. Started working for an engineering firm that allowed me to kind of focus on that. And really, the rest is history. I started getting into medical gases, started getting into waterborne pathogens, learning how the purified water systems needed to be treated and put together for central sterile processing departments. And I was hooked. So I didn't really intentionally set out to go into focusing on plumbing as part of a mechanical engineering system type, but I backed my way into it and have absolutely loved every minute of it since.
Excellent. So engineering and healthcare is in your genes.
Definitely. And it was really right around the time of when Legionella really started with a lot of these standards that have come out, such as ASHRAE 188 and 514 came out later, but ASHRAE 188 at the time and Guideline 12. That I really started wanting to dive into this more and understand all of this that's kind of impacting, especially in the healthcare side. And so I spent a lot of years around that time really starting to focus on that. And really there was opportunities to speak at the Legionella conference, which happened to me in 2018 in Baltimore, Maryland. And that's where a gentleman by the name of Pete DeMarco, former executive vice president of IAPMO, he just retired. He noticed me and we started conversing, and that ultimately led me to being hired by the International Association of Plumbing and Mechanical Officials back in November of 2020. And it's been a great organization to work for and be part of. I feel very privileged to have the position that I do and to really help the organization really make an impact on public health safety and in other ways.
And we're so glad that you are able to share some of those talents with FGI. Today, we're going to talk about plumbing in healthcare and codes and standards. To start off, maybe our first topic of conversation is scope. Scope, as you know, is very important when we talk about codes and standards, not only knowing which book to open to find a requirement, but also when we're writing codes and standards, we want to make sure there aren't conflicts between books. So in your mind, what is the division of scope between FGI-related codes and the plumbing codes?
That's a great question, John. And I guess the way I would think about, especially in codes and standards, and having come from the engineering consulting side where we use these on a daily basis, back in the day, I think the way I would describe it is, plumbing code focuses on plumbing systems and FGI tends to focus on the architectural elements, let's say. However, as I've matured and progressed in my career and have gotten the experience, what I have found is that more often than not, they really interface and blend together, if you will. And you have to really be intentional and thoughtful about how the codes themselves interface with each other. So sometimes there is a bit of carryover from one area to the other. In general, the FGI plumbing provisions that we looked at as a task group this last cycle tended to focus on some of the more architectural elements. What type of fixture? We looked at things like where are they supposed to be located? And then there was reasons for that. We also looked at some of the references in the documents and making sure that we're referencing applicable plumbing codes and standards. So again, part of FGI that I had to refer to, one of the most common ones, for example, was the number of medical gas outlets and inlets. That's just a very common one that I had my sort of quick reference to that particular table in the FGI guidelines as a plumbing design professional. But a lot of the how to put it all together in the parts and pieces, that's where you're referring to other codes, such as the UPC, which has a full chapter on healthcare codes. You also have NFPA 99, which touches a lot of the medical gas requirements. And so, yes, there's sort of parts where things start and stop. But there's still that interface of these systems are all connecting together. And ultimately, that's what it's all about.
Right. You kind of need all three of those to put together a full picture of expectations around plumbing. One of the ways I think of it is plumbing codes like the Uniform Plumbing Code really tell you how to pipe a sink and vent a sink. FGI will tell you where that sink needs to be, and does it need to be a scrub sink versus a utility sink, things like that.
Yep. And actually, it's always important to make sure that you're referring to the right code. And if there's a question that comes up, to make sure that the HJ, that you're understanding what the HJ is going to want you to follow. So there's always those potentials out there, but like the table in the UPC is a much smaller table and shorter table than the one in FGI. And so you would end up following the one that's more stringent. So again, there's opportunities because not every state adopts the FGI, not every state adopts the UPC. And so we're working in this environment where we're just all trying to do the best we can. And that's why discussions like the one where, that FGI and IAPMO have had on working together, this entire task group that we're working on, it's so important to keep that communication open, to keep making improvements.
Exactly. When you mentioned two different tables in two different books, applying to the same concept, number of outlets. That's why correlation is so important. So another big picture question for you, if you will, from a plumbing and water quality kind of perspective, what are some of the key subtleties or nuances about healthcare? What makes a plumbing system in healthcare special?
I like that question a lot, John, because you're talking about there's a certain uniqueness to healthcare and plumbing. And that was, from my experience, designing water, sanitation, and medical gas systems. So the overall plumbing for healthcare had some very unique, very specific challenges. And part of the reason why I enjoyed it so much was because of that uniqueness and that challenge of it. You could almost even make an argument from a plumbing design perspective. If you can design a hospital as a plumbing design professional, you could probably do most other types of buildings fairly easily because of the complexity involved. So the two main, if I was going to boil it down to the two main things, the first is that the population, it's an immunocompromised population of people with weak immune systems, people that are getting treated for various ailments. And we want to put a system in place that certainly does not negatively impact them in any kind of way. And that extends from water usage to the sanitation system, making sure that the system is able to prevent disease from coming out of the sanitation system, and also medical gas, making sure those medical gas systems have the proper certifications, such as ASSE 6000 series and whatnot. So the first is the respect to the population that's there. We want to make sure to try to keep them as safe as possible.
Right.
The next key component of this is the resource use, though, especially from a water perspective. Healthcare facilities often have some of the highest water usages out of most building types. Just because if you look, you have patient rooms that have showers and bathing facilities throughout the facility. The central sterile processing department uses a lot of water to try to keep devices clean and equipment clean. And that's not to mention any other, non-potable uses, such as irrigation, mechanical makeup, or other things. And so we have to find a way to try to balance that complexity overall of the system with two what could be very opposing criteria. One, especially on the water side, such as the safety component of water, but also the sustainability side of water. And that's one area where I think IAPMO, we really excel. We developed a concept called plumbing resiliency, which covers that and a couple other topics as well, such as affordability. And it's a framework that we feel like is very important because if you focus only on one, it's oftentimes to the detriment of the other. You have unintended consequences that way. And so it's really vital when you're thinking through solutions to making sure you're looking at it in a way that is holistic. That is, you're considering that second and third order effect.
Absolutely. I love that you mentioned that and that IAPMO is thinking about that. I think that's a common goal that FGI and IAPMO has. Like you said, healthcare and residential care can be just resource hogs when it comes to the building type, not only with plumbing, but electricity. And when we look at those, not only first costs, but ongoing costs for maintenance of that and operations of that system, being mindful of resource use, I think is close to the heart of FGI, and it sounds like it's close to the heart of IAPMO as well.
Definitely, most certainly.
So stringing all those concepts together, we have really complex systems, and those systems get used a lot. And then you combine that with immunocompromised patients, and that means a greater likelihood that when something goes wrong, those impacts are going to be more severe. So it's really a unique confluence of risk here. We have this common overlap of interests, IAPMO and FGI. And in a 2026 cycle, we took advantage of some of those common interests and created a framework sort of for mutual benefit. Can you talk a little bit about that framework and what made this cycle so unique?
I think one of the very first, very important key steps was when IAPMO and FGI signed an MOU in June of 2021. We were able to get that put in place. And really, when you look at the press release, I mean, it really speaks to the point of the whole thing, right? Which was what you just described, John, was let's look at ways to collaborate. Speaking as a plumbing industry professional and having been in a lot of rooms, often plumbing's the last one that is talked about during the construction process. We're often forgotten. And to just have FGI really step up to the plate and say, we recognize this importance, I think just speaks to the forward-thinking approach that FGI has. And I can't commend FGI enough for showing that plumbing is necessary, that it is an important and a very vital part of a healthcare facility.
Yeah, that MOU recognized that we're operating in similar spaces and there's overlap. So coordination, making sure that IAPMO doesn't tell you to do one thing and FGI tells you to do something completely opposite. That's something that's very, very important.
And I think that's a great point, John, because again, I think that correlation aspect is one that we definitely pride ourselves on. And I think having those conversations, that's where I think we were able to do a lot of good. So fast forwarding to the 2026 FGI code development cycle, Doug Erickson, reached out to me and said, hey, Christoph, we're starting up our new cycle and we'd like to create a plumbing task group who take a look at all the FGI documents, the healthcare, outpatient, and residential long-term care documents, and really take a look at it from that plumbing expertise perspective. Is that something you could help lead? And I said, of course. I mean, honestly, especially having utilized FGI guidelines on many, many projects, I was very honored to be asked to be part of it. What was amazing to me was how that whole thing started growing and developing. And I think that the end result is one that I think anybody that has been involved in it can be very proud of.
Absolutely. And like you mentioned, the steering committee appoints task groups every cycle, key focus groups to look at topical issues. And not to say plumbing isn't exciting, because I think it's exciting, but I think we were first wondering if the plumbing task group might be a little mundane for this health guidelines revision committee. But quickly, it became one of the most popular and well-attended topic groups that we've ever had. What do you think caused that?
I have to say that was probably a little bit of a surprise for myself too, because I have been in rooms as an engineer and I've been raising my hand. Can we talk about the plumbing
Right.
system? And it's not one that many people places a lot of priority. And I think that's changing. I will say, I think a lot of people have recognized that. I think what ultimately helped get more people engaged with this was a relative understanding of what, as a human species, our relationship with water was. So the small group we started with had about 5 professionals that signed up. It pretty quickly ballooned to, I think, over 20, especially once we started including subject matter experts as part of our committee calls or task group calls, I should say. What was really amazing about that group was that we had HJs, owners, nurses, interior designers that were all part of this. And everybody was getting really excited about this concept of, hey, here's the things that we're trying to prove, and here's why. And I think once we made that connection to the why, a lot of people were like, oh, I've been wondering about this, or this makes a lot of sense. And the infection preventionists, we had a number of them on there too, and they especially had a really good understanding. That was probably one of the favorite other task groups that we interfaced with on a regular basis. It honestly felt the plumbing task group and the infection prevention task group became best friends by the end of the whole process. And I think it was always there. It just needed to have just a little bit of a flashlight put on it in terms of a little bit of light to just say, hey, here's this thing. And I think, again, it comes down to the fact that every human being needs access to water. We all need sanitation that crosses so many divides. And when you start realizing that these things that we've been doing where we haven't been necessarily as thoughtful about it have a potential negative impact, once people made that connection, people wanted to get involved.
One of the things you did in the beginning was make it clear that this is also a conversation about scope. We're not trying to rewrite the plumbing code. The plumbing code handles plumbing engineering kind of questions. FGI is about performance and function and how that function requires amenities within a building. And then there's operations. FGI doesn't get into operations, and there's other standards out there that handle that operational aspect of engineering and ongoing operations and maintenance.
I would definitely agree.
Given all these conversations, what do you think the biggest challenge or controversy that came out of that plumbing topic group was?
Oh, that was an easy one to identify. And I would say it was everything around the topic of water age. That was one that the plumbing task group very quickly identified as a top priority in terms of coming up with proposals to try to address it in various ways. And ultimately, I don't want to say necessarily controversy, but definitely it resulted in what was described to me after I went through it as a Senate confirmation hearing for myself at one of the particular FGI meetings.
You got grilled.
Honestly, yes. Fortunately, I was able to answer questions in a way that helped people out and trying to explain a concept that some of them may have only heard of it for the first time. And really the concern was an important one to bring up.
Could you give us a sort of a nickel tour of what water age means?
Certainly. So in a healthcare facility, one of the biggest concerns right now, especially since ASHRAE 188 came out in 2015, is the concern of waterborne pathogen amplification. So as I mentioned, there's sensitive populations within a healthcare facility, and the water system that comes in from the water purveyor, if it's not managed well, it can become an additional risk to those populations. And that's what really ASHRAE 188 mentioned, which is water management programming, which kind of crosses that divide of how do we apply this within the construction framework. So the biggest thing I can say from the concern of water age is that there's 2 main disinfectants used in the US, chlorine or chloramine. That's what the water purveyors put in the water before they send it into the utility piping system to every building, including a hospital. Both of those dissipate over time. Chlorine, pending other water quality parameters, takes about 24 hours. Chloramine, which is ammonia added to chlorine, takes about, pending water quality parameters, about a week. But both of them dissipate. Both of them are not 100% effective. In the realm of microbiology and disinfection, you talk about logarithmic reductions. So a 6 log reduction is a 99.9999% reduction, which means if you have 1 billion bacteria, you're left with 10,000 after a 6 reduction. So
Wow.
So we don't talk in terms of water quality and managing microbial risk as a eliminate. We talk about control. We're trying to, again, minimize that risk. And so part of the problem is the way that we've been sizing plumbing systems basically assumes that every building, including the hospitals and long-term care facilities, they were sports stadium at halftime type of water usage, which means that your peak flow rate is going to go way bigger, which is going to increase your pipe size. And when you get your true flow rates are maybe 27 times lower than what you estimated it to be, the age of that water, the amount of turnover to get fresh water in with disinfectant, it takes a lot longer of a period of time. And that's where it's really important to look at a lot of these water management documents. They talk about flushing their systems regularly, which is not particularly sustainable, but that's the best way out there right now. And so what makes water age, though, what made it a very controversial subject and a bit of a challenge is that there's a number of guidance documents and standards out there that we ended up correlating this cycle that were referenced either through the future handbook appendix or in other places that indicate that things like low flow fixtures are health hazards. One of the big ones was the National Academy of Science, Engineering, and Medicine. They had a consensus report that was released in 2020, Management of Legionella in Building Water Systems, that specifically said low flow fixtures should not be used in healthcare and long-term care facilities. The American Society of Plumbing Engineers, ASPE, came out with a subsequent document in 2023 that was called, the mouthful is Engineering Methodologies to Reduce the Risk of Legionella in Premise Plumbing Systems, also known as ASPE Legionella Design Guide for short. They said the same thing. They took the NASEM informations and they came to the exact same conclusion. So you had a scientific body and an engineering society that both came up to the same conclusion. And so making sure that we understand that right now, because we don't have a better way to size hospitals, although I know we're working on that, we're actually looking at data for healthcare facilities and would welcome conversations with facilities to look at that further. Right now, we don't have it. And so because of that, it is a concern. And really, the NASEM and the ASPE guidance documents are probably two of the best ones to refer to. So there was a lot of back and forth and conversations and trying to help people understand that, hey, this is a concern. And really, there's no other way to size it. Because one of the questions that came up, is there other ways to, like, well, the engineer can size differently. There's not another way, that they're bound by the plumbing codes to do it this way. And so that's a challenge. But one of the other things that we try to make a connection to, and this is where those lines get blurred between scope, is that the plumbing fixture locations, which are typically chosen by the architect, that has an impact on the water age, because the further you spread out those plumbing fixtures, the more water piping you have to have, which length times your pi times your radius squared gets you your total volume in that water piping. So length, which is dictated by the architect selecting locations, is a very important part of trying to minimize water age. And that was one that had not been made before. And so the plumbing task group came up with several proposals and whether it was in official code language or as part of appendices, to try to help point architects to saying, hey, you're having an impact on water age, and that's going to also have an impact on sustainability.
So the length and the volume sitting there for a period of time, that is water age. It's not how old the water is, it's how long that water sits in a particular pipe. And the longer the pipe, the greater likelihood that that water is going to get stale, for lack of a better term.
Yes, definitely. So that was the other big connection we tried to make with some of the proposals. There were other things such as flushing locations or automatic sensors for flushing, or even dead legs, and better defining what that is and how to minimize it and minimize the dead legs through flushing options that we also tried to address. Some of them made it, some of it didn't. But I think one of the biggest things that was, while it was a challenge to bring up this topic of water age and water quality and helping connect that dot to the architectural side, I think the fact that this topic was talked about as robustly as it was and the awareness that was brought around it, that to me was a huge success of the plumbing task group this go around. And I'm hopeful that we can continue to make strides here in future editions of the FGI guidelines.
I think this is something that will have legs as we go forward into other cycles. Speaking of code cycles, every cycle I think we have what I call sleepers, and those are those changes that may not get a lot of attention, but really make some impact. What do you think are the most meaningful proposals that kind of flew below the radar there?
I think one of the most meaningful set of code changes was just updating the references. One of the things that the plumbing task group looked at was trying to make sure that the latest code standards, manuals, guidance documents, that those were included in various references throughout. There were certain places where, because the U.S. has a variety of plumbing codes across it. A lot of states have state-by-state adoption. 4 states have their own code that they create. Places like Arizona and Texas, you have every city picking their own plumbing code.
Oh, wow.
So yeah, it can be very challenging. So one of the things that we made a modification to was focusing on terms of plumbing code language, is saying it's the locally adopted plumbing code, which I think was a very important step in all of this. But the other part was the inclusion of other references in terms of really good documents that should be part of the conversation. So For instance, the aforementioned NASEM report and the ASPE Regional Design Guide, those were two that were included in there that were not in there before. A lot of the main model codes were included in there, but some other documents we were able to include as well, such as the Backflow Prevention Institute manual. That was a topic that was added into a few of the backflow prevention areas as a consideration, as another reference. Another big one, I think, though, was the inclusion of the Water Efficiency and Sanitation Center that IAPMO produces. And one of the things that really became apparent in reviewing the documents was that this concept of improving water efficiency while maintaining safety was really key. And that's exactly the definition and scope of the Water Efficiency and Sanitation Standard, known as WESTAND for short. And so having references just to make sure that design professionals were aware of this. So that way topics such as water reuse or direct potable water reuse, which maybe not be used there, but at least they know where to turn to for some of these things, because sometimes they're not included in model codes, depending on where it's adopted. So having references like that, things like the water demand calculator, things like the area ratio, which is one of the things that was added recently to the 2023 WESTAND. These are all important pieces in terms of better promoting water efficiency while maintaining safety. That will be, I think, serve really the FGI guidelines well in the long-term future.
Yeah, and definitely designers, as they're approaching some of these questions. I mean, a lot of times those signposts that we can provide to folks, whether it's a required reference in the code or more informational one that would live in the handbook and what we used to call appendix languages, that's really important. What are some other notable changes that we talked about? I know you folks put a lot of proposals in.
Yeah, we had a pretty high number of proposals. And I was looking through the numbers we're seeing, it seemed like about a 70% acceptance rate, which was, I think, a little bit on the higher side, which was pretty, from what I've heard. So I was pretty pleased to see that people were receptive and open to the conversations. We had some definitions, especially like instrument air quality, better defining that and making sure we had, again, the appropriate standards reference there. One of the big ones was the removing of aerators, especially under some of the sustainability parts. Some of that, it depends on which code you're in, whether it's like healthcare, outpatient, or residential, but really looking at not utilizing low flow faucets and showers, but replacing them potentially with pressure compensating faucets and showers.
Yeah.
Things that'll let you kind of control that flow better regardless of the available pressure, and making sure that you have adequate turnover of that water. Some other things that we looked at was also faucet and sink coordination, making sure that things were aligned and not that you're causing an abnormal amount of splashing. And then there was a number of proposals that revolved around improving dialysis box cleaning. So I think that overall, I think that the success was attainable because we had a really good dialogue with a lot of different stakeholders. We got a lot of different input in there, both from plumbing industry experts and those that are just sort of generalists within the healthcare environment. I think it lended itself to that high success rate and us being able to get a lot of really amazing work done.
Yeah, you mentioned faucets and sinks. One of the things that the glossary committee tackled this time is sink definitions. So coming up in the 2026, you'll see an updated list of what a utility sink is and what's the difference between a floor sink and a mop sink and a hand wash sink and a scrub sink.
Perfect.
Well, we're ending up here, and I just wanted to give you the opportunity to look into the crystal ball and think about healthcare, plumbing, and design. What do you think is going to happen in the future?
I think the one big trend that we're going to have is that concept of plumbing resiliency is going to become more vital. And I think really in the healthcare environment, more than anywhere else, this need for us to look at the sustainability of water resources, especially, but also maintaining the safety of those systems is just going to increase in importance. And I don't think I think that's going to be the topic that's just going to be one of a continuing dialogue, especially because the science is continuing to emerge on this as far as best practices. That's what I would see and what I would hope, because I think we did a lot of work this go around. But I think there's a lot of conversations were ones that were said, I think we'll do this one the next code cycle. So my hope is that we can find ways to maybe even have a more specialized group to take a look at some of that and work through that in the future here.
Yeah, things to look forward to going forward. So Christoph, when you and I get together, we have a fun thing that we sort of do. I appreciate the German language. I'm awed by it. And you're a fluent German speaker. So in the context of plumbing systems, can you tell me how to pronounce some plumbing things, maybe like backflow preventer?
Well, first off, anything technical in German, what we like to do is we like to take the definition of the word and then we like to cram it all together.
Okay.
And it just becomes one word.
Okay.
So in German, the word for backflow prevention is Rückflussverhinderer, which means literally backward flowing water stopping thing. So I just
That's
take the
great.
definition, right? It's like literally the definition of the word. And it's funny because German is always known as a little bit of a harsh language. There's a really great YouTube video and spoofs of that video that you can find even on social media that talks about comparing the German language to things like to English and to Italian and Spanish and some of the Romance languages. And my favorite one, I think that's applicable here, is the word for ambulance as well. So like in other languages, Ambulanza. In German, the word for ambulance is Krankenwagen, and that word just sounds a little bit harsher than some of the others.
Krankenwagen. That's great. Well, folks, there's your German word for the day, Krankenwagen. Here at FGI, we believe in general education. All information is valuable. So, Christoph, thank you so much for being with us today and sharing not only your knowledge of plumbing, but your knowledge of German. And we hope to see you out there.
Definitely looking forward to it. Thanks, John.
Thanks for joining us for another episode of Between the Lines with FGI. Do you have an idea for an episode? Or perhaps are you interested in sponsoring one or more episodes? Get in touch with us by sending us an email to podcast@fgiguidelines.org. Upcoming topics include the safety risk assessment, quench pipes, and rural healthcare. Many thanks, as always, to Neil Kane and the Neil Kane Trio for the use of his song Skip to My Lou from the album of the same name. And please, join us next time as we go between the lines with FGI. Goodbye, everybody. Ruckenfluss Verhinderer? No. Ruckfluss Verhinderer? No. Ruckfluss Verhinderer.